Hi, I'm Dr. Dave Janda. Welcome back to the Operation Freedom platform and our ongoing series with the great Dr. Peter Glidden on your nutritional health and well-being. This is about our 21st, 22nd presentation. All of these videos are available on the website operationfreedomhealth.com or davejanda.com. And it's an entire series. We compass a lot of ground in this approach. And it's an approach that you're not going to see, hear, read, or experience through what I call the bought-off lamestream fake media, because all you have to do is see who's advertising on the bought-off lamestream fake media. Pharmaceutical companies and insurance companies. And guess what? They despise what Dr. Glidden and I speak about on this series. So, big pharma doesn't like this. Big insurance doesn't like this. Big medicine, such as the AMA, doesn't like this. Because this is about empowering you with information as it relates to nutrition and wellness. Today's topic is going to be on the coronavirus and specifically how to boost your own immune system, which is the key. My guest is a good friend of mine and someone who I believe is a top nutritional expert in the world, Dr. Peter Glidden. His background: Peter attended Williams College. He then was involved with his pre-medical studies and obtained his Bachelor of Science in Pre-Medical Studies from the University of Massachusetts, and then obtained his doctorate degree in naturopathic medicine from the great Bastyr University in Seattle, Washington. Peter has been licensed to practice naturopathic medicine since 1992. Now, in addition to his phenomenal clinical skills, as you'll see the comments underneath our videos, many of his patients, former and current, log in. And they talk about the very positive impact Peter has had on their lives from a clinical standpoint. But in addition to his fantastic clinical skills, Peter is an outstanding author. His two books are the foundation of our medical library in our home and in our friends' homes because they're both such important books for your health and well-being. They're available on Amazon, entitled Everybody is Sick, and I Know Why, and Attempt a Cure with Holistic Medicine, both written by Dr. Peter Glidden. Peter, welcome back to the Operation Freedom channel and the operationfreedomhealth.com website.
Thanks, Dave. It's always a pleasure hanging out with you.
So, well, it's a pleasure with you as well, Peter. Peter, let's talk about the coronavirus. It was stated by the lamestream media, well, somebody ate some bat soup, and that's what led to this issue. So why don't you give us an introduction, if you could, Peter, about the coronavirus and what's going on here?
Well, so the coronavirus is, well, first of all, a little background on what the heck is a virus. Because nobody ever talks about this.
Now, right? Let's start with that. That's a great foundation.
Yeah, it's an interesting thing to talk about. And, as a holist, we like to get to the root of things, right? So viruses are organisms which mainstream science does not know how to classify. They are defined as organisms which exist on the edge of life. A virus is DNA wrapped in a protein coat, and that's it. A particle of a virus particle can lay dormant on a rock for 1 billion years. Nothing happens to it. It freezes, it rains, it's hot, it's a monsoon, it doesn't matter, it's not affected, it's dormant, it's not alive. And then an animal comes along and puts its paw on the rock and then scratches its face with the paw, and the virus gets inside the animal. Once a virus particle gets inside a biological organism, it comes alive. It activates, and the virus's job, once it's inside a living biological organism, is to duplicate itself. How does it know how to activate itself? How does it know to duplicate itself? Because it wants to duplicate itself means, well, we can assume that there's some type of consciousness there, that there's some type of modus operandi there, and yet it can lay dormant for literally millions of years. What's going on? And also, this is something that's fascinated me forever. Cold and flu season is only in the winter months, right?
True.
But when it's winter here, it's summer south of the equator.
Mm-hmm.
And because of international jet travel, one can assume that the influenza virus is everywhere all the time. So why are we only afflicted with the flu in the winter months? And the same for people below the equator. What is it about the change in the seasons that makes us more susceptible to the negative effects of a virus? And this is a very important thing to talk about, because when we are talking about viruses,
Mm-hmm.
we must focus on strengthening the immune system of the human body rather than waiting for some vaccine to be developed, which is most likely going to be dangerous and ineffective. So strengthening the immune system is everything when it comes to a viral infection. Now, coronavirus is called a coronavirus, and it's a family. Coronavirus is like cats. There's a lot of different types of cats, right?
Mm-hmm. Mm-hmm.
Coronavirus, there are many different types of coronaviruses. They're all called coronaviruses because when you look at them under a microscope, it appears like they have a little crown
Mm-hmm.
on their top, and in Latin, corona means crown, right? So it's just what it looks like visually. Years ago, in 2003, I think the SARS epidemic
Mm-hmm.
was caused by a coronavirus. A different coronavirus than is coming worldwide now from China. The SARS virus self-limited.
Mm-hmm.
There were no vaccines. There were no treatment strategies. The only thing you did was quarantine people who you knew had it and or who you thought had it, and within 4 to 6 months, it completely disappeared. So not everybody who's affected with a virus gets sick. Not everybody who's affected with a virus dies. Most people who are affected with a virus develop symptomology, which is uncomfortable and problematic, but then their immune system rises to the cause, fights it, and they get better. And I would argue, I haven't dug into these data, but I would argue that the people who die from viral exposure are people who were already weak, had weakened bodies in the first place, the elderly and newborn kids, right? Weak immune systems by definition. So we needn't worry about a pandemic, like a Hollywood epidemic coursing over the planet that's going to kill 90% of the people who it infects. It's not like that at all. However, and there's stuff that we can do to upregulate the immune system. We're going to talk about that in a minute. However, this coronavirus apparently is a nasty little virus.
Mm-hmm.
And it's infected, I think, 3 times as many people as the SARS virus did in 2 weeks as the SARS virus affected in 3 months. It's a very nasty little bug, and I think it was weaponized.
Yeah, and I would agree with you. I've presented some information on my platform about that the epicenter where this started, Wuhan, is where their what's called a BSL-4 category containment center is, and part of their bioweapons, it's their top bioweapons program in China.
Yeah, and the chatter on the internet is that it's thought that this particular coronavirus was smuggled
Mm-hmm.
out of a lab in Canada
Mm-hmm.
into China, and then they tweaked it,
Mm-hmm.
and then they released it, and you don't have to look very far for a reason for that, right?
Right. And conspiracy theory, conspiracy reality can go hand in hand, if you will. Let's face it, there were some issues happening in China before this outbreak, right? There was the freedom movement occurring in Hong Kong, which was then spreading to the mainland. And now with this, the recommendations are quarantine, nobody's moving, right? Stay inside your homes, don't congregate. We're going to limit air travel, people coming in, so people don't know really, the reporters aren't going to be coming in to talk about what's going on. And, oh, by the way, since we're limiting air travel, dissidents cannot leave. Could it be a coincidence that this occurred when it occurred and how it occurred and where it occurred and where it started? It surely could be a coincidence. But
it's like a duck and flies like a duck and quacks like a duck, right? It's probably a duck.
Right.
And also it's good to be the king.
Yeah.
Inside of a dictatorship like they have in China, they can do whatever the heck they want.
That's right.
And nobody's going to know.
That's right.
How many hundreds of thousands of people are in internment camps in China right now?
No.
I honestly don't know how. I mean, when I shop, I go out of my way to not buy anything that was made in China.
Mm-hmm.
Right?
I agree.
So I'm in a department store and I want to buy a shirt or a tie or something, and I've got a choice of 100 different brands. I'm going down the rack looking for the ones that are not made in China.
And it can be difficult sometimes.
It's really difficult.
Yeah.
It's a lot more difficult
right.
than one would assume, but it's amazing to me that, how many people died in the Vietnam War because we were, fighting the spread of communism.
Yeah.
And now China, which is the worst communist dictatorship in the modern era, how much debt do we owe them? I mean, how much money have we borrowed from them, and we continue to trade with these people? I mean, how can if I was a Vietnam veteran, I would be ticked off about our relationship with mainland China.
Many of the Vietnam vets I know are, for that reason.
It's a crazy inside out, upside down, mixed up world.
So when folks go to see their docs, Peter, and I've gotten some emails on this, they ask their docs, well, what can I do to enhance my immunity? Okay, to protect myself potentially, even though it's a long shot, protect myself from not just the coronavirus, but other viruses, other bacterial. And one of the things I always told my patients when they brought this up when I would be practicing, and they would laugh at me when I'd say this, I would tell them to wash their hands frequently.
The most important thing anybody can do.
Well, people just look at me and go, oh, come on, doc.
Hands.
I go, let me ask you, I would say to the patients, what do you think I did before I walked in the room today? I washed my hands. And I go, and what do you think I'm going to do?
Your colleagues did that.
And what do you think I'm going to do when I leave the room today? Wash my hands today. And I do that for protection, for you, my current patient, and the next patient in the next room, but also for myself and my staff. It's the single most effective thing you can do, Peter.
Yeah, hands down, because, here's what happens.
No pun intended.
Especially with the coronavirus, because it's attracted to the upper respiratory tract for some reason. So you got a coronavirus in your body, you sneeze or you cough, and you cover your mouth like this just automatically.
Yep.
Now there are virus particles on your hand. You touch the doorknob, you touch the escalator rail, you touch the rail somewhere in the mall, in public. You put your hands down on the counter. Now the virus particles are on the counter, and they're going to survive there for 1 billion years.
Right.
Now the human being comes on, puts their hand down in the same place. Now the virus particles are on their hand, and they do something like this or rub their eye, and now the virus is in their body, and bada bing, bada boom, you
got it.
Biggest vector is hands. Now, here's a fun fact to know and tell that we haven't talked about in the past. Longevity makes a foaming cleanser. It's called PureWorks is the company. They have a soap and a foaming cleanser, which is oil-based. It's not alcohol-based. And it has an antibacterial chemical in it, which is I forget the name of it off the top of my head. It's really good. It lasts for 5 hours on your hands. So during cold and flu season, or times of epidemics, if you wash your hands a couple times a day with the PureWorks soap,
you're covered. And
then you keep a little spray bottle of the foaming cleanser in your purse if you're a woman, or in your jacket pocket, or in your desk, and every 3 hours spray some on your hands, rub it together, you're covered. Get a big bottle of it, stick it to the garage door, and every time the kids come home from school during cold and flu season, you have them put that on their hands, you're going to be good. You're going to really knock down the vector for transmission a lot. And in this regard, Benjamin Franklin was correct. An ounce of prevention is way worth, way more than a pound of cure.
And from a nutritional standpoint, Peter, what do you recommend?
Well, okay, so the human body, let's use a metaphor. Human body's like an automobile.
Mm-hmm.
Human body dealing with a virus is like an automobile going uphill in snow.
Got it.
So to make the automobile healthy, which we have to do, you can't be driving down the road with 15 pounds of air in the tires if you need 30. You can't put diesel fuel in an unleaded engine. If you need 6 quarts of oil, you need 6 quarts, not 1 quart. If your coolant system needs a gallon of liquid and you have an ounce in it, you're going to have trouble. If the power steering fluid needs a pint and you've got a teaspoon, you're going to be in trouble. So your automobile has to be maintained and has to be running at top efficiency. So this is, because we're holists and because we are proponents of this particular method is why we get such remarkable results. So number one, everybody needs to stop eating the 12 bad foods. You can get that video at Operation Freedom Health for free. Number two, everybody needs the Healthy Body Start Pack. They need the Beyond Tangy Tangerine, the Beyond OsteoFX, the Pro-Hobas, and the plant-derived minerals to fill their body's nutritional tank up to the brim, nutrify the body with everything that it needs all of the time, and then your car's in good shape.
Mm-hmm.
All right. Now we're driving up a steep hill in the snow. Well, if you're driving up the steep hill in the snow, probably you should get out and put chains on the tires. When I was in medical school in Seattle, we used to go skiing. There's a ski resort. It's called Snoqualmie, about an hour and a half east of Seattle, and 3-4 times a year we drive up there. And the road approaching the ski resort, it was illegal to drive on that road unless you had chains on your tire. That's how much snow they got, right? It was mandatory. You had to put chains on the tires in order to help with the traction. So, in order to help the body during cold and flu season or potential epidemics, there is one botanical medicine that stands out hands above all the rest specifically for antiviral activity and strengthening the immune system. It's called olive leaf extract. And nobody does, honest to God, nobody does olive leaf extract better than the people at the Good Herbs Company. And the name of the product is Super Olive Leaf Extract. It's an alcohol extract. For prevention, if you're an adult, I would recommend 2 milliliters 3 times a day. If you actually come down with something and you're feeling like sick, then I would go 4 milliliters 4 times a day if you're an adult. And also, if you're sick, coming down with especially a respiratory thing, if you get some colloidal silver nebulizer, you get a nebulizer for like $40 at Walgreens. You put a teaspoon of colloidal silver. My favorite is a brand called Argentin 23 colloidal silver. And you inhale that stuff 4 times a day during an illness, up the ante with the Super Olive Health during the illness. Take the Super Olive Health preventively, during this time. You're going to be in good shape because you don't get sick and die because there's a virus in your body. You get sick and die because there's a virus in your body and your immune system is really weak. Why is it weak? Not because you have a bad gene, not because you're getting older, but because you've been eating all the wrong food all the time and your body is completely running on nutrient fumes. It's weak. This is really not rocket science, and we need to, spread this message to as many people as we possibly can, especially during, potentially weaponized virus epidemics, and the world's kind of a big deal. We need to be mindful here moving forward so that the immune system in the body is as strong as it possibly can be.
Interesting about olive leaf extract. I've been taking that every day for over 20 years. And here's why. I didn't learn about it in medical school internship, residency, fellowship, or in any presentation of any conference I went to. I had a patient, Peter, who about 25 years ago, who was a farmer. And he sustained a very bad fall and had a very bad fracture to his leg where the bone came through the skin. And he was in a barnyard environment, so the chance of that getting infected was enormous. We operated on him, we cleaned him out, we set the bone, we took care of him. He had antibiotics in the hospital, sent him home on antibiotics to take by mouth, and I was following him along. And the first time he comes in, about a week after he went home, everything looked great, doing fine. We taking everything taking everything. And he comes back a couple weeks later, and he's doing great. Wound's great, healing up just very quickly. And no evidence of infection, which really surprised me because I thought we might have to bring him back for a washout procedure based on where he was injured and the bone coming through the skin with the contamination of the soil and the like. And he said, Doc, I got to be honest with you. I go, oh, okay, what's that? He goes, so you gave me all those antibiotics to go home with, right? I go, yeah. He goes, so I didn't take them. I go, what? He said, I didn't take them. But I did do something else. He goes, I learned from my dad that olive leaf extract is something you should take to prevent an infection. So I've been taking a lot of that. And I said, I don't know anything about this. He goes, well, I go, I'm going to do this, but maybe you should start on the antibiotics in addition and then do this too. And he goes, no, I'm going to just keep doing this.
It's amazing, isn't it? You know, and if you go to PubMed.org, which is the database for the Centers for Disease Control in the U.S., and just type in a search term olive leaf. Yeah. It's amazing the published research.
Yes.
Up. I mean, it's published, peer reviewed.
Yes.
This stuff is extremely potent and effective to upregulate the immune system in the face of a viral insult. And a couple things to understand about botanical medicines, right? Wine is made from grapes. All wine is made from grapes, but there's a pretty big difference from bottle to bottle based upon a lot of variables. Mm-hmm. Well, all olive leaf extracts are made from olive leaf, but there's a pretty big difference in the potency and the effectiveness based on a lot of different variables. For instance, there's a main ingredient in the olive leaf plant. I believe it's called olesterin or something like that. Don't quote me on that. But nonetheless, it's an active ingredient in the upregulation of the immune system. Now, there's a lot of constituents in the plant that are necessary, right? But this is kind of a big one. Different olive leaf plants grown in different places on planet Earth will have different levels of this phytochemical. And the people at Good Herbs only purchase wild-crafted raw olive leaf from the regions of planet Earth that have the highest concentration of these phytochemicals. They use 200 proof alcohol, not 100 proof alcohol. They'll incubate the stuff. They'll saturate the olive leaf in the alcohol for 8 weeks instead of 2 weeks at set temperatures and conditions. And the steps that they take in order to optimize the effectiveness of whatever it is that they're making are extraordinary, because they are not concerned so much with the bottom line and cutting costs and getting as much product to the marketplace as fast as is possible. They're concerned with quality and effectiveness. Mm-hmm. And, a nice bottle of, Pinot Noir from the Willamette Valley in Oregon is quite a bit different from a bottle of Pinot Noir, and I hate to say this out loud, Dave, grown in Michigan.
No.
Big difference.
Yeah.
Right?
They are.
And it's the same with olive leaf, and nobody does it like the Good Herbs people. It's a remarkably effective product, and I'm happy to educate people all about it.
And it's something I can attest to. I take it every day. And
pudding's in the eating, right?
what's that?
For the pudding's in the eating.
Absolutely. And you also mentioned colloidal silver. When I mention that to my friends, about what can I do? My kid is sick, and I say olive leaf, and by the way, colloidal silver.
Yeah. The most progressive burn hospitals in the United States have been using colloidal silver topically now for about 5 years, and they get way better results than other hospitals that don't do that. It's a very effective therapeutic. It's a very effective, and again, Longevity doesn't have a colloidal silver product that I'm really that thrilled about.
Mm-hmm.
The one that I like that we don't have any skin in that game at all. But I'll tell you about it because we want to get people healthy. It's called Argentin 23. Just do a Google search for Argentin 23. Lots of people sell it all around the country. That's the best, most effective colloidal silver in my opinion.
Yeah, it's interesting. 30-some years ago, Pete, when I was in my residency, and we'd have to rotate onto the burn unit, and the standard treatment to help those folks was Silvadene cream, which is impregnated with silver.
Isn't that interesting?
Yeah.
Yeah, there's a lot to be said about minerals. I think that's where the research is going to go. Copper is another very important one. Another thing that you can do if you have the money and you want to help knock down virus or bacterial infiltration into your house is get copper doorknobs. Because if a virus or a bacteria lands on a piece of copper metal, it's disintegrated within seconds.
Mm-hmm.
Copper kills it.
Yes.
It kills it. And if I was the Surgeon General of the United States, all the metal in every hospital, the doorknobs, all the countertops, all the handrails, everything would be copper. 100%.
Agreed.
100% copper. And if you just did that, you would knock down
infections enormously.
Enormous.
Yeah, it would be enormous.
Yeah. Well, what are we going to do? I think we should call Trump up. What do you think?
Why not? Well, Peter, I'd like to thank you for your insightful conversation and for the information you provided. So here's the deal. You mentioned the 12 bad foods. That video is on the website, very top of the homepage of OperationFreedomHealth.com. We've talked about the foundation pack with the nutrients, the 90 essential nutrients. That is present on OperationFreedomHealth.com, as is the olive leaf extract. Now, for folks that purchase through OperationFreedomHealth.com, full disclosure, purchasing through OperationFreedomHealth.com does support this platform. So we keep doing these things. So we keep being able to pay the IT staff to edit these and network these and get these up for folks' consumption. The products are there. The information is there. All of our other videos are there as well. And again, and this is something that I spoke about at the beginning of our interviews, the foundation for your health should be based on solid ground and solid information. And that's where the books, Everybody is Sick and I Know Why, and Attempt to Cure with Holistic Medicine, both written by Dr. Glidden, should be your foundation. It's our foundation. And I assure you that it's time well spent reading because your health and your wellness is on the line. And this is a very effective way of enhancing your health and making your life better. Peter, I'd like to thank you for everything you have done, are doing, and will do. Folks, I hope you'll join us at OperationFreedomHealth.com. And until next time, Dave Janda signing off. Dream big and dare to fail. Thank you for your time today.